Hello. So let's talk about disc problems. So everybody, as they get older, at some point will have back pain. And we see constantly on social media huge amounts of information about what you should do and what you shouldn't do. But most people find it really difficult to understand and cut through the chaff. So we're going to talk about some things that are the latest research and what actually happens with back pain. So you can see here I have got my lovely old-fashioned model of two vertebrae with a disc represented by this red bit in between, and you can see that this is my spinal cord and here are the facet joints. Well, here's what happens. So over many years, classically, of overloading with poor flexion posture while sitting down, your discs literally wear out. So the disc is a gelatin-like structure surrounded by 15 to 22 rings of a special cartilage. And if you look here at this smooth edge here and this here, in a perfect world, we want those two edges to be parallel. But when you slump badly, they start to do this, and you sit there all day long, day after day after day, and eventually what happens is we get that, your elusive and rather horrible bulging disc. And of course, that's where the problem starts. So people then go, right, well, I've been diagnosed with a bulging disc. I've got sciatica where it rubs on the nerve roots. But what they don't realise is that, yes, they will recover from that from 6 weeks to maybe 3 months to maybe even 6 months. But there will be a permanent problem there if you don't do the right things about it. And here is the issue. The problem is once you've had one of those, there is a permanent instability there. So every time you cough, roll over in bed, what happens is a micro movement, a little wriggle between those bones. And it's more at this disc than it will be at the discs above or below because it has been damaged. So then we have to start talking about core stability. And this is one of the most poorly understood things amongst therapists and of course patients. And most of the time, people don't understand what they're trying to do. So what is core stability? Well, core stability is about developing new senses of anti-flexion, anti-extension, anti-rotation, and anti-shear, stabilizing muscles to reduce that micro movement. And we often then find that once this has happened, yeah, you'll recover in 6 weeks, but if you don't correct the core stability, what will happen is that over a period of time, that constant micro movement will lead to osteoarthritis. It will lead to facet joints problems as they try and stop the micro movement, but you get wear here, and it can end up with those horrible conditions that you get much later in life called spinal stenosis. So to find out more about how you should do core stability and what you're trying to do, check us out at www.norsefoundation.com.